Okay, awesome. Hello, everybody. My name is Gabby Vega. I'm the program coordinator for the Center for Pediatric Traumatic Stress. And thank you for having us back today to do part 2 of this webinar series. So today, Dr. Kim Cantor and I will be presenting the second part of preparing, coping, and conquering stressful medical events. And we're going to be discussing strategies for children with intellectual or developmental disabilities. Strategies for parents and caregivers of children with IDD. So for those who don't know who we are and what we do, I'll give a quick recap. So CPTS is actually celebrating its 20th anniversary this year. So our mission is to address health-related trauma in the lives of children and families. We are part of the National Child Traumatic Stress Network with a focus on medical trauma. So we focus primarily on increasing awareness and recognition of medical traumatic stress. And we do that by developing and disseminating tools and resources for professionals. And we provide trauma-informed care training, and we develop resources for patients and families. And we have a multidisciplinary team that brings together psychology, social work, medicine, nursing, and public health. And we have team members located in Pennsylvania, Delaware, Kentucky, and Maine. And on the bottom right corner, you'll see a QR code, and there's also a link to a 20th anniversary report that we just published. And that's highlighting our work over the past 20 years. So if you're interested, you can check that out. Oh, sorry. My screen's broken. So today we're going to be talking about pediatric traumatic stress, including common reactions to potentially traumatic medical events, how to identify medical traumatic stress in your family. We'll also be talking about coping stress strategies, self-care, and share some resources and tools for caregivers and families as well. So what is a pediatric stressful medical event? So in part 1 of this webinar, we defined what a pediatric stressful medical event was. So we'll start with that just as a quick refresher. So when we're thinking about trauma, specifically medical trauma and traumatic stress, there are 3 pieces that need to occur, and we call these the 3 E's. So individual trauma results from an event, series of events, or set of circumstances. So something that has happened that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the person's functioning, mental, physical, social, emotional, or spiritual well-being. So trauma equals potentially stressful event, and traumatic stress equals reactions to that event or experience. And it's also important to note that what counts in risk for traumatic stress is not the objective severity of the child's illness or disability, but the subjective experience of that child or parent. So are they feeling scared or hopeless? And, do they think they might die? So it's the individual's experience of the stressful medical event, not necessarily the event itself that's traumatizing. So what role does stress play? So there are 3 types of stress: positive, tolerable, and toxic. So positive stress is a normal part of healthy development, characterized by brief increases in heart rate and mild elevations in stress hormone levels. So examples of events that might trigger a positive response, stress response could be, child's first day of school, a toddler stumbling while they're learning to run. So it's time limited. So stress levels and responses do return to normal. So positive stress is it's very normal. Tolerable stress is more serious, but still temporary. It has the ability to be buffered by supportive relationships. So this is the stress that we can't avoid, but we can support after, something happens. So things such as losing a lost one, a natural disaster, a serious injury or accident would fall in this category. And then you have toxic stress, prolonged activation of stress, never ending, and the lack of those supportive relationships. What we know is that prolonged exposure to toxic stress can have profound impacts on the social, emotional, and physical health of our children well into adulthood. So these experiences that they encounter daily can impact the trajectory of their lives. So why is this all important? Why are we talking about it? So research has found that pre-existing exposure to emotional trauma can put children and families at higher risk of having trauma reactions and can lead to new trauma or re-traumatization. A systematic review of over 200 pediatric traumatic stress studies found that the rate of significant pediatric medical traumatic stress was approximately 30% across pediatric medical populations. They also found that 10 to 75% of children and up to 22% of parents have persistent trauma symptoms. And what makes children and families vulnerable to new trauma reactions? So there's several things to consider. A stressful medical event or an experience can challenge your beliefs that the world is a safe place. So we want to think that we can make the world safe for our children, but unfortunately, that's not always the case. It also involves a realistic or subjective sense of life threat. So that the child's life is in danger, or we believe that the child's life is in danger. Experiences with treatment procedures that may be frightening or painful. Children and parents may feel helpless during these experiences, being exposed to pain, injury, or death of family or friends. And because of COVID-19, all children and families have faced disruption and changes to normal life. So families with a child who has an existing health condition may have particular stressors and worries. And the way that children respond to stressful medical events is also influenced by their age and development. So now we're going to talk about some of the common reactions to potentially traumatic, those stressful medical events. So, and first, I want to make sure to make the point that the majority of children and families are resilient, but some have psychosocial concerns that can impact course of treatment and beyond. So as you can see in this hand-drawn diagram, most people are in the center in terms of showing many signs of resilience, but we do have families at both ends of the continuum. So on the left side of the diagram, you'll see children and families that are having more psychological difficulties. So that could be, things such as PTSD or depression. And on the right side, we have the families experiencing post-traumatic growth. So what can be traumatic for children? So again, it's all very individual experience. Some children are going to find things traumatic that others might not, and vice versa. So there are many aspects of a stressful medical event that can be traumatic. Being left alone in the hospital or during the medical event or procedure, being in pain or getting painful procedures done, having a noticeable illness or disability, being exposed to medical equipment that's frightening, and being in the hospital overall can be frightening, the noises, the sounds, fearing what other kids will think of them, the uncertainty of what will happen next, thinking that being in the hospital is a punishment or something they did wrong, and the fear of dying. So all of these could possibly be traumatic for children. So children may have a wide variety of reactions, which vary by age and developmental stage. So younger children's responses to a traumatic event, such as a stressful medical experience, tend to be more behavioral. They will show you that they're upset rather than tell you. So parent report and your own direct observation of child behavior are usually the best ways to assess the impact of traumatic events on young children. And we often need to rely on observed behavior rather than verbal reports to understand how a young child or a child with IDD is feeling and coping, as they might not be able to verbally communicate that. So younger children can regress to younger behaviors, such as bedwetting, thumb sucking, in response to distress. They may have strong startle responses, nightmares, outbursts, since their brains do not have the ability to calm fears. And they depend on parent presence and support to soothe and calm them more than any other age group. And parents and caregivers can help younger children process their reactions through play, drawing, and storytelling. And school-age children will watch closely and take cues from adults' nonverbal behaviors regarding how serious the illness or disability is and how to respond. They may discount verbal explanations if what they observe and notice does not match what the adults are telling them. In addition, they might use their imagination to fill in the blanks when they do not have realistic information. Sometimes imagine that an illness or disability is punishment for something they did wrong. They can experience significant grief and loss reactions, even if the loss was expected and discussed. So we encourage parents and caregivers to ask open-ended questions to school-age children to learn what they know and especially what they are imagining. And adolescents can be more concerned about the here and now issues more than the future. In addition, they, will sometimes act more grown up than they feel inside, may cover up their worries to protect others, may not like the feeling of being dependent on parents and other adults due to illness and disability, just as they're trying to move, towards more independence, can be idealistic or unrealistic in their expectations, and can be self-conscious and sensitive about looking different from peers. So parents and caregivers can encourage adolescents to anticipate and plan for future consequences, but don't dismiss their here and now concerns as well. So traumatic stress reactions are very common. Up to 80% of children and their families experience some kind of traumatic stress reactions following a life-threatening illness, a diagnosis, an injury, painful medical procedure, an accident. So the good news is outcomes can be improved through stress reduction and better coping strategies. And now I'm going to turn it over to Kim. I skipped the slide for Kim, which is talking about identifying medical traumatic stress in the family.
Great. Thanks so much, Gabby, for getting us started. Okay, we were just switching the mouse. There we go. Okay. So what I want to talk to you about next is how to identify post-traumatic stress symptoms for yourself, for other members of your family. And I want to just reiterate something so important that Gabby said, which is that we don't want to think about post-traumatic stress as only related to certain things. What you might experience as traumatic or what your child might experience as traumatic is individualized and different. And these symptoms are not exhaustive, but these are some of the more common symptoms of post-traumatic stress. And the things that we don't intend this at all to be diagnostic, but if you were thinking about post-traumatic stress disorder, there would be some overlap here. So some common symptoms are reliving or re-experiencing past traumatic events. So if you had a particularly negative experience with a procedure or during a medical visit. Things like the smell of hospitals or triggers like that might you might re-experience those things. Avoiding reminders or staying away from reminders of the stressful event, feeling jumpy, on guard, or on edge, checking over and over, that sort of thing. Having negative thoughts or feelings of guilt, and then other common symptoms include things like difficulty focusing, developing new fears, feeling numb, things that are different from your norm. And building on that, these are some, as a parent or caregiver, some signs and symptoms that your children might need additional help. And something we really like to say here is, as the parent, you know your child best, and anything that is striking you as different from your child's normal behavior is one of those things that signals to us that additional help might be warranted. So some examples of what this might look like are all of the sudden wanting to be alone, or if your child usually is more independent and likes to do things by themselves, wanting to be with you all the time, seeming easily overwhelmed, jumpy, or irritable, social changes from what's normal, sleep difficulties, behavioral changes. And we like to call out also, sorry, the slides are not, there we go. We also like to point out that this can apply to siblings also. So if you have more than one child in your family, some of the things that you see in your child with Down syndrome or other developmental or intellectual differences might appear in the sibling also. We know we're focusing in particular today on your needs and your stress as a caregiver. And there's some similarity to what we've been talking about with the children, but this can also look a little bit different for caregivers as well. So some things that might be warning signs that you as the caregiver are experiencing too much stress or might want to seek additional support, or things like being unable to enjoy your usual activities, always thinking the worst, having disproportionate reactions to things, having a hard time talking with your child, feeling like you're not performing at your normal levels at work, at home, in the community, chronic sleep difficulties, or if things that are normal for you seem to be getting worse. And I know we keep coming back to this because it's such an important point, but everyone reacts to stressful, potentially traumatic events differently. So you might not experience everything that we've talked about. You might not experience things at the same time, but in awareness of what these signs are, what they might look like for you and your family, can help you both take care of yourself and seek professional help if needed. And we'll come back to that at the end. But we want to talk here too about again, just when you might advocate for a referral for you or your child for additional help. So if you're noticing something that's different, it's going on for more than a couple of days or a couple of weeks, or it's really interfering with your everyday life, those can be signs that you might want to seek additional help. And the reason we keep stressing this is we want you to feel empowered to seek the help that you and your family might need when something seems different. And it's important for us to just always know at this point that if there's an emergency or a crisis, 911 or now 988 are always good resources in a situation like that. What I want to transition to next is some strategies and tips that we know from our work with families, that we hear directly from families, and what we also know from the research that's gone on in our field is some ways to cope with stress and some self-care tips and guidance. So taking time to practice self-care, as a mom, as a dad, as a parent, it can sometimes sound impossible, especially when your child has needs and needs that at times might feel overwhelming. But we do feel like it's important to, to talk about taking care of yourself. I think in analogy that people use sometimes in our field and that you may have heard is that idea of, you have to put your own oxygen mask on before you can help the person sitting next to you or your child. And to that end, being sure to meet your basic needs. It might sound simple, but it's hard to be effective. It's hard to do anything if you're not sleeping or eating, doing the things you need to meet your basic needs. Paying attention to your own stress and emotions. So being aware of what you're feeling and what you're experiencing, again, puts you in the best position to be able to help and care for the people in your family. And part of that means talking to trusted family, friends, a doctor, a counselor, a clergy person, if you identify as a religious person. And in addition to the basics, trying to find time to do an activity that helps you mentally and emotionally recharge. Finding time for yourself, even if it's just a few minutes, can help you keep going when there are periods of increased stress. And again, this awareness, this knowing when you need more support, is so important. And we wanted to highlight a few ways a few ways that you might be able to know when you need more support. So again, this awareness of knowing what your thoughts or your concerns are, so you can connect the dots if they're affecting your child or your family. Sometimes, and this is something that may or may not be happening at your child's care center, but screening during medical care, your child's provider, or your own provider during well visits, asking you questions about anxiety or depression or how you're coping. Resources you might access through the communities you're connected to, and then doing what you can to get the resources you need, ask questions of your care team as appropriate, pointing your care team towards education to provide good family-centered trauma-informed care that includes, being aware of the impact that stressors can have on a family system. And this I think we covered this concept earlier, but is just really important to us. So just things being different for you, noticing that you're more on edge or your needs aren't being met is an important warning sign. Right. And there's no one size fits all. There's no single answer for everyone. And with that said, we do want to now provide some things that might help you take care of yourself and your family, some tips or strategies. So an important piece, related to what we've been talking about this morning is understanding what normal reactions and feelings are. So if if your child really struggles with a blood draw or another type of monitoring or a checkup, understanding that it's normal to feel stressed, to feel worried, to not be looking forward to that doctor's visit is important. And also understanding that it's normal for your child to have a hard time with something they don't like. So we don't want to just say, oh, they're gonna melt down and do whatever needs to happen to get it done. I don't want to suggest that's what we're saying, but understanding that your child is going to have reactions and letting go of that pressure to kind of have it go perfectly can be a helpful thing. And related, being aware of your own feelings and reactions. So knowing what your triggers are, knowing what might help you be able to manage the visit. To that end, making a list or having ideas of how to answer if someone offers to help, doing, fun or meaningful things as much as possible. So we talked a lot in part one of this series about distraction and ways to support your child. That works for adults too, doing things that are fun and enjoyable, meaningful to you, especially if you're leading up to something that is going to be tough, can help keep your mind off of it. And then again, just this point of remembering your own needs and feeling empowered to ask for help if it's needed. This, I think, is a really nice slide because it highlights some kind of quick things you can do that in the moment can help you feel better, can give you a break from what might be going on inside of your brain leading up to something stressful. So you can think about 2 minutes, taking some deep breaths, stretching, just stepping away from your computer, looking outside the window or getting outside if it's a beautiful day. 5-minute activities. I guess the step outside is in our 5-minute activities, but taking a break, listening to a song you like, getting a cup of coffee, having a snack, doing a quick mindfulness activity, that sort of thing can help you reset and find the kind of power to keep going. And we also want to just provide some questions that can help you dial in and focus on what you need. So asking, what resources or supports do you need? What information or resources does your child need? What resources are available to help? Taking that big picture look at what you need as a parent and what your family needs to help you get through a stressful or challenging time. And what we want to spend this next chunk talking about is just additional resources and tips for parents. So I mentioned distraction earlier, and this slide actually is focused on supporting your child, which hopefully helps with coping as a parent as well. But we want to empower you as parents to speak directly with your care team about what works best for your child. So what we're talking about here is you have a medical visit, you have a blood draw, your child needs a flu shot, you have a longer specialty care visit. Be clear with the team if there are things that help. Pick tools that will keep your child's attention, get going with the distraction, ideally, if you can, a little bit before the procedure starts. Stay focused on your role in leading distraction. We encourage avoiding saying things like, it's okay, you're fine. Just because, in the moment when you're feeling really overwhelmed or upset, it usually doesn't help calm down to be told like, oh, you're fine, this isn't a big deal. And then after the procedure, and this is a useful thing, I think, too, as a parent, to kind of help you reframe a stressful experience after the fact, is provide specific positive feedback about what went well following the procedure. So, wow, you were so brave. You got your flu shot, and that's going to help us stay safe this winter. Wow, you were so brave. We let the doctor take your blood. I maybe don't say we let the doctor take your blood, but give specific feedback about what went well. And this is really important because it helps your child prepare for the next time and feel good about it. And it can help you as the parent too, if you focus on something that did go well, even if what went well is just you got through it, that kind of can help you feel more prepared, feel better about the next time. I think we shared this resource last time too, but this is a very nice tool as a parent for supporting your child. So this is a website, Distraction in Action, and you put in some information about your child, and it will provide you with customized resources, all focused on distraction during procedures. And this is another strategy that, it can be helpful for children, but also can actually be very helpful for caregivers if we're thinking about those 2 to 5 minute coping strategies. This is just a deep breathing tool. And what you basically do is you take a breath in as you trace up a finger, pause, breathe out as you trace down. And you go around your whole hands, breathe in, pause, breathe out, breathe in, pause, breathe out. So it gives you something very concrete to focus on, and it cues you to really be using that deep breathing. This is a strategy or tool that we call the footsteps to thought reframing, and it's a very helpful exercise for parents. We kind of walk through 4 strategies to maybe think about a stressful situation in a different way. So accept the uncontrollable. So what about this situation is unchangeable? And the reason we say accept that is because a lot of the time we get stuck on trying to fix or change things that we really don't have control over. And that can make you really not feel good and ultimately doesn't impact the outcome. So what are the parts of this situation that we can let go of? And then on the flip side, what can we control? So maybe we can't control that the phlebotomist, the person working in the lab that day, is not the person who does the best job with our child, or we can't control that the doctor's running 30 minutes late. What can I control? Well, I can provide my child with some tools to feel safe and comfortable. I can do my deep breathing. I can reset, identify and acknowledge your own strengths. So as a parent, what are the strengths that you have? I am confident that there are many. So think about what those strengths are, and then using those past 3 footsteps, is there a different way we can think about the situation? So if we let go of what we can't control, we focus on what we're doing, we recognize the strength we have, Is there a different way to maybe think about this? And this helps us get to a coping plan too. So going into something stressful, and depending on your child's abilities and what they might be interested or not in doing something like this with you, thinking about things you can do, things that bother you or things to avoid, and things others can do to support you can be very helpful going into a stressful situation. The last strategy or tool that I want to share is just a slide highlighting some ways that you might be able to directly help your children prepare for stressful events by helping them identify different emotions, what those feel like, what the words are, what it means for them, so that they have the ability in a stressful situation to talk to you or to show you what they're feeling so that you can help. So these are just some cute ways to teach kids about different feelings. So this here is a worry monster where you can kind of identify worries and feed them to the worry monster. This activity just involves drawing different emotions on toilet paper rolls, tubes of emotion, and then having them bubble over with like in a science fair type experiment, just to make it fun. So helping your children understand what feelings are is helpful for kids, teens, young adults, and also can be helpful for us as adults to really make clear connections between what we're feeling and how that impacts us. And I'm going to pass back to Gabby now.
Okay. And we just wanted to share some additional resources and tools that can be used for the whole family. So here we have some tips to help families that are seeking therapy services. If you're considering therapy for you or your child, but have questions about finding the right person to work with, what kind of therapy would be best, or what to expect when you're talking with your medical team or your child's school. That's a good place to start, is talking to your doctor, talking to school counselors, and questions that might help that you can ask your provider are, what can I expect each time my child comes in for a session? Have you worked with families in the past who've experienced medical trauma? Do you have experience working with children? What type of therapy do you provide? And in general, treatment for medical traumatic stress should directly address the traumatic experiences related to the illness, to the disability, the hospitalization, and your child's reactions to them. It should include you as a parent in the treatment. It should support your family's needs so that you can best support your child. And it should focus on reducing traumatic stress symptoms for the long run, but also on helping your child cope and function better with any current challenges. And you can also ask about insurance coverage. If you don't have insurance, it might be helpful to contact local therapists or agencies and ask, or ask your provider, ask if they offer a sliding fee scale or a payment plan, and also find out if your child or family is eligible for federal or state coverage. And we also provided another QR code here on the bottom and a link to a blog that one of our CPTS team members wrote, a blog for parents who are seeking therapy or considering therapy. And forgot to mention also, we'll be sharing all of these resources with all the attendees today. So we'll send out a PDF version that will have all these resources and links that you can click through as well. So the National Child Traumatic Stress Network, which is the network that CPTS is part of, has a list of national resources for assistance with various types of child trauma. And the Society of Clinical Child and fast forward the slide. And Adolescent Psychology has a great website with information about evidence-based care and referrals. And a question that we get a lot at CPTS is also, where can I find help near my family, where we live? So here's a list of national organizations that provide more resources to finding a psychologist or a social worker, a psychiatrist, a therapist, and just additional resources to find a clinician or a counselor or just a mental health professional. And again, we'll share all of these resources and links at the end as well. And our website, so CPTS has a website that we run called healthcaretoolbox.org, and here's a QR code and the link to this too, where we provide resources for healthcare providers, but also patients and families. So this is just a screenshot of the main landing page, and you'll see we have a section specifically for patients and families. And on healthcaretoolbox.org, you'll find evidence-based tip sheets and workbooks for kids, parents. They are all in English and Spanish. They're free to download, and we also have hard copies available for purchase. So on Healthcare Toolbox, you'll find a lot of resources for coping with stress reactions, resources for children and parents. We also link to a lot of the other organizations that we work with as well. And again, all of these resources are available in English, in Spanish, and we do have some tools that are also available in other languages as well. We also have, CPTS has two websites. So apart from Healthcare Toolbox, we also have After the Injury, which is in English and Spanish. And since it launched in 2015, or the Spanish version launched in 2015, we've had over 200 visits per year. And now over 20% of those visits are from Spanish speaking families. And another resource that we wanted to share, the CELI Coping Kit was created as a tool to support parents or other caregivers helping their child or child siblings manage the medical experience. So the kit was designed to increase positive coping strategies, utilize evidence-based cognitive behavioral coping techniques, like relaxation and social support seeking, for a range of challenges such as medical procedures, emotions related to the child's medical condition, recovery and treatment side effects, and challenges related to school and peers. And the kit identifies stressors that are specific to medical conditions, like nausea, pain, needle sticks, long hospital stays, and suggests a variety of coping tips for each stressor. So currently it is available for children with cancer in English and Spanish, sickle cell disease, injury, for siblings of children with medical conditions. And they are currently developing more versions for different populations as well. And we wanted to share some specific resources for siblings. And these are some resources from an organization called Ryan's Case for Smiles, which is a family-led organization that we CPTS has partnered with. And they have some useful resources for caregivers and siblings. So they have a website called copingspace.org, which offers coping strategies and tips for families. And they also recently launched a new site for teen siblings called justsibs.org. And here's some medical traumatic stress specific resources. At the bottom, you'll see some links to the Invisa Youth Charity, which is another family-led organization that CPTS has partnered with. Invisa Youth is a nonprofit organization that helps teens and young adults around the world with various chronic illnesses and disabilities. with lifestyle programs, empowerment tools, and fun resources. And Kim and I actually had the pleasure of being guests on their podcast last month. So we also did include the QR code and link to our podcast debut as well. And here's just some additional online sources. At the bottom, you'll see that distraction action tool link as well. And again, we will send all these links to everyone. And in the next couple slides, we share some books and reading materials for families. And one book we wanted to highlight is the book Afraid of the Doctor, which was written by CPTS Associate Director, Dr. Megan Marzak. And it's a parent guide to preventing and managing medical trauma. And it's available now. And here we have a list of books and reading materials specifically for parents. We also have a list specifically for kids and teens. And lastly, we just wanted to share some COVID-19 specific resources. We know that the impact of the COVID-19 pandemic goes beyond the threat of infection and physical disease, and that this evolving situation also has psychological and emotional impact. So we wanted to make sure to highlight some of those resources as well. And that's all we have for you today. So we just want to thank you for your time and attention, and also want to remind everyone to follow CPTS across our social media platforms. So we are on Twitter, Instagram, and Facebook at P Trauma Stress. And I shared the QR code again for our healthcaretoolbox.org website. And if you have any questions or comments, please feel free to email Kim or I or the cpts@nemours.org.
Thank you both so much. That was a wonderful presentation. I think as a parent myself of a child with Down syndrome and who has had an extensive medical history, I think it is important that we as parents remember to take a moment and think about ourselves as well and find our own coping strategies. So this was really wonderful. I'm going to stop recording. We do have a few minutes left, and I'd like to open it up to some questions if anybody has any.